When I was at university, I wasn't really sure what I wanted to do. A lot of my friends were applying for grad schemes in banking and finance and all that. I knew I wanted to work in mental health or something to do with people. So it was really good when I found Think Ahead. In the morning I will arrive, normally a bit before 9.
Morning.
Morning.
There's 3 other Think Ahead participants and our consultant social worker. And then in my office there are other qualified social workers, community mental health nurses and occupational therapists, psychologists and psychiatrists. It's quite a varied team, it's a big team, everyone's really friendly. I arrived in this team in September, having done all of the training, all of this knowledge and getting ready to go, and it was quite scary to start with. I remember my first meeting with the service user and I was feeling quite anxious about it because I hadn't really done anything like this before. To be under this team, the mental health problem has to be quite severe. There is a perception that people with these psychotic illnesses are dangerous or scary, and I feel quite embarrassed that I had that perception to start with. When I leave the office, there's all kinds of different things that I would do with someone, like we might go out for a walk in the community, or it might be a crisis plan or a relapse prevention plan, looking at what people like when they're well and what that's like for them, and then what it's like when they're feeling unwell and how to prevent that. I do have really tough days and people can be feeling really hopeless. I don't have a magic wand to just kind of fix everything, but there are things you can do and strategies you can teach people. John is my consultant social worker. We have weekly supervision, which is where I can talk through all the people I'm working with.
Yeah.
Get some sense of his anxieties and sort of issues he has in public. So you've got something you can then sort of establish with him as a way forward.
Yeah, okay.
It's really nice to be able to come back from a visit and debrief. A lot of people that I have worked with, you can see quite a dramatic change from that hopeless state that they start with. They might not have been able to leave the house. I've worked on that and worked on the anxieties about going out. When things do start moving, it's really rewarding to see how people can change and see hope again. I was working with somebody who was very low and feeling very hopeless, and he'd tried all kinds of different antidepressants in the past, all sorts of different medications, but he said that he was finding the work that I was doing much more helpful than the medication. It's a really good feeling to know that that's changed their life. I don't think I ever did think about what impact a mental health social worker could have on people's lives. I really enjoy getting up in the morning and going to work. It's exciting and it's varied and it's never boring.